Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week, our medical director, Dr. Michael Marciello, will be talking to you about conservative treatment options for spinal disc injuries. If you've ever been diagnosed with a herniated or protruding disc, you're not going to want to miss this episode. Take it away, Dr. Mike.
Today we're talking about one of the most common things we see in the office, back pain. Well, do you know that nearly 80% of all of us have experienced back pain at some point in time? It's mostly because it's such a common problem, there's a lot of moving parts, and most of the time it's relatively benign, and we don't have a lot of difficulty getting over a back strain or some back pain that we may have experienced. But if we think about through our lifetime, 80% of us will experience some kind of form of back pain. But what do we most worry about? What do we always hear about concerns? You've got a disc problem. Well, I'm here today to really think about and tell you what it really, some of the terminologies and what it really means to think about having a disc problem. Whether it's a disc herniation, a disc protrusion, a disc bulge, all these type of words are very confusing for the average person because they do have different meanings, but the idea is that the discs involved typically will give a lot more problem and back problems and pain and spasms and severity. So we just break it down a bit. When people say, I have a disc bulge, we really don't need to get too excited. That's a really relatively normal process of our bodies going through its degenerative changes. It may bulge out a little bit. It's not like it moves that far and goes back in, but it does protrude a little bit beyond the border of the bone, so that's why they call it a bulge. And it really doesn't matter that the bulge is present, it's a matter of, is it pushing on anything? Is that bulging disc touching the nerve and causing sciatica? Is the bulge pushing upon some of the nerve endings that are localized to go give us some back spasms and result in actually increased pain? But if we think about a little more serious problems, a disc protrusion or a disc herniation are nearly similar. One actually means that the central part of the disc material has herniated out of the borders of the disc, and that causes much more problems and typically can lead to a lot more serious sciatica or causing nerve pain running down your leg. And there are cases that there needs to be urgent surgery, for a disc herniation that is pushing upon the nerve, and the only solution is to remove that disc material. That's pretty uncommon. Nowadays, treatments for back problems and back disc problems are more conservative. And that's why here at Maragal Medical, we think about all the alternative aspects of thinking of disc treatment and back pain treatment. If we think about the idea of my back went out and people say, my back's out, well, it didn't really go into a large separation or that there's a disc that came out and it's got to go back in, or the bones have shifted such a far degree. But it really means that the body can't stand up and hold its natural position because it hurts. It tries to run away or deviate from the pain source because that disc is inflamed or the joint is inflamed and your back could so-called be out. But when we started out thinking about getting it back in, which really is not putting it in place, it's really to soften the tissues by getting some stretching. So our chiropractors can get on special decompression tables called Cox tables that you can do soft manipulation or a classic adjustment. Great way to start working on the early onset of a disc flare or a back pain flare. If we think about our Hanova machine, our fancy components of robotic technology to study the core muscles, we want to get some exercise and engage those core muscle groups to get you stronger and engage the aspects of recovery. If we think about the medical side, I need to try to decide on the urgency. The acute flare, the inflammatory process may need a very short course of prednisone. We try to minimize that type of treatment, but it's necessary in many cases to hit it early, get the inflammation down, maybe turn to some ibuprofen for a little bit longer while we're working on the chiropractic and soft tissue work. If you have a more disc herniation, then I'm determining if there's actually damage to the nerve running down your leg. The sciatica may cause pain, but it doesn't necessarily have to cause damage. We need to decide if we're getting an MRI. Do I need to refer you to the surgeon for that urgent visit, or can we watch? because typically a disc flare or protruding disc that's inflamed may take 3 to 6 weeks to truly settle down. And people forget about that. They want urgent and quick relief. And so we got to work at it early on to get mobilization, but recognize it may take a number of weeks for it to resolve. What can we do in that time frame? We think about putting a lumbar corset, a decompressive back brace that makes the body a little bit more supportive and helps protect it by keeping it in a neutral position. We utilize local trigger point injections, which kind of go into those muscles that get all tightened and knotted up into our back paraspinal muscles or buttocks hip muscles that are aggravated because of the disc. Or we look at the aspects of regenerative injections when the disc has an element of degenerative arthritis that accompanies it. We can treat some of those inflammatory joint flares and helping that reaction so your back may kind of calm down and not be in spasm so abruptly. There's many ways to think about a back problem, and no back problem is the same. So I don't like to hear, well, my uncle, brother, and my sister had this problem, I know what it is. It really varies, the levels of disc problems, the number of nerves involved, the right and left sides, and the joints versus the disc. We need to look at it all. And here at Maragal Medical, as a conservative approach to spine care, we can put that all into place. Chiropractic, physical therapy, and medical, all in combination to make a better assessment and give you the best patient care. Give us a call. We want to take care of you. Back pain we see every day. Take care. See you next week.
That was great information, Dr. Marciello. I think you all now have a better understanding of all of the available conservative treatment options that you have available at Maragal Medical if you've been diagnosed with a spinal disc injury. Of course, there are conditions that require immediate surgical intervention, but statistically, most patients need to exhaust all conservative options before considering surgery. At Maragal Medical, we take a unique approach to patient care. We combine medical care, chiropractic treatment, physical therapy under one roof and utilize newer technologies like regenerative medicine and robotics to make sure each and every patient gets the best care possible. And we take most insurances. If you like the information you saw today, please subscribe to our YouTube channel. More information about our practice can always be found at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you on a path to wellness. I hope you had a great day today. We'll see you again next week. Take care.